In this video, I'm about to show you how a massive Medicare fraud scheme finally imploded after years of fake medical claims finally triggered federal action. This wasn't a small operation. This was a network of fraudulent providers who stole hundreds of millions from American taxpayers by billing for procedures that never happened, equipment that was never delivered, and patients who didn't exist. And they thought they would never get caught. They were wrong. Let's get into it. The Department of Justice announced in early 2025 that a massive Medicare fraud scheme operating across 5 states had finally been dismantled. The network, which operated under dozens of shell company names, submitted over $800 million in fraudulent claims over a 7-year period. The scheme involved telemedicine fraud, genetic testing fraud, durable medical equipment fraud, and hospice fraud. The defendants included doctors, nurses, marketing executives, billing specialists, and the owners of the fraudulent companies. Attorney General Merrick Garland said, "This takedown demonstrates the department's ongoing commitment to rooting out fraud in our healthcare system." But here's what he didn't say. This scheme should have been caught years earlier. The warning signs were there. The data was there. But it took whistleblowers, brave people who worked inside these companies, to finally bring it all crashing down. The scheme involved over 50,000 Medicare beneficiaries. 50,000. That means 50,000 Americans, elderly, disabled, vulnerable, had their Medicare numbers stolen and used to bill for fake medical services. Most of them had no idea it was happening. One victim, Margaret O'Brien, an 82-year-old woman from Ohio, had over $200,000 in fraudulent claims submitted under her Medicare number. $200,000. She had no idea. She only found out when a federal agent knocked on her door. Another victim, Harold Jenkins, a 76-year-old veteran from Michigan, had his Medicare number used to bill for back braces, knee braces, and genetic tests, over $150,000 worth. Harold never received any of it. He had no idea his number had been stolen. How did the fraudsters get these Medicare numbers? They bought them from corrupt call centers. Call centers that targeted seniors told them they were qualifying for free benefits and got them to recite their Medicare numbers over the phone. The seniors thought they were signing up for something helpful. They were actually handing their identities to criminals. The core of this scheme was telemedicine fraud. And let me tell you, the way it worked will make you furious. A company called American Telehealth Solutions, based in Florida but with call centers in Texas, Arizona, and Nevada, was the hub of the operation. The owner, David Rodriguez, a 54-year-old businessman with no medical training, set up a network of telemarketers who called seniors across the country. The telemarketers used a script. They would say, "Medicare now covers free genetic testing to determine your risk for cancer. All you need to do is provide your Medicare number and answer a few questions." The seniors trusted them. They provided their numbers, and then the fraud began. Once Rodriguez had the Medicare numbers, he sent them to a network of corrupt doctors. The doctors, Dr. Alan Schwartz in New York, Dr. Michael Lee in California, Dr. Patricia Miller in Texas, and Dr. James Wong in Florida, would sign orders for genetic tests, back braces, knee braces, and other expensive equipment. These doctors never met the patients, never spoke to them on the phone, never reviewed their medical records. They just signed, and for each signature, they were paid $500 to $1,000. Dr. Schwartz alone signed over 30,000 orders in a 2-year period. That's over 40 orders per day, every day, including weekends and holidays. He made over $15 million from his signatures. He used the money to buy a penthouse in Manhattan and a vacation home in the Hamptons. Dr. Lee signed over 25,000 orders. He made over $12 million. He bought a mansion in Beverly Hills and a fleet of luxury cars. Dr. Miller signed over 20,000 orders. She made over $10 million. She bought a ranch in Texas and a private jet. Dr. Wong signed over 18,000 orders. He made over $9 million. He bought a yacht and a vacation home in the Florida Keys. These 4 doctors alone were responsible for over 90,000 fraudulent orders. 90,000. That's 90,000 patients whose Medicare numbers were used to bill for fake services. 90,000 victims. And what did the patients get? Nothing. Most of them never received any equipment. Some received cheap back braces that cost the fraudsters $20 but were billed to Medicare at $2,000 each. Some received genetic test kits that were never processed. Some received nothing at all. The fraudsters also billed for genetic tests that were never actually run. They would collect cheek swabs from seniors, sometimes through the mail, sometimes at fake health fairs, and then throw them away. But they would bill Medicare for the full cost of the test, up to $10,000 per test. One lab, Pacific Genetics, was charged with submitting over $150 million in fraudulent genetic testing claims. The owner, Dr. Stephen Chen, had never run a single test. The lab didn't even have the equipment to run them. He just billed, and Medicare paid. And here's something that didn't make most news reports. The telemarketers who called seniors weren't just random employees. They were trained. They had scripts. They had rebuttals for every objection. If a senior said, "I don't think I need this," the telemarketer would say, "It's free. It's covered by Medicare. You have nothing to lose." If a senior said, "I'm not comfortable giving out my Medicare number," the telemarketer would say, "We already have it on file. I just need you to confirm it." That was a lie. They didn't have it on file. They were phishing. And too many seniors fell for it. One telemarketer, Sarah Miller, testified to the grand jury that she was taught to target seniors who lived alone. "They're lonely," she said. "They're happy to talk to someone. You just keep them on the phone long enough to build trust, then ask for the number." Miller felt guilty. She quit after 3 months. She became a whistleblower. Her testimony helped convict the call center operators. She's eligible for a reward, but she said she doesn't want the money. She just wants the calls to stop. That's the kind of person we need more of. Another major part of this scheme was durable medical equipment fraud. Back braces, knee braces, shoulder braces, wrist braces, all billed to Medicare at thousands of dollars each. The fraudsters would get the orders from the corrupt doctors, then submit claims to Medicare for the equipment. But most of the equipment never shipped. One warehouse in Florida, operated by a company called Mediship Solutions, was found to contain over 50,000 pieces of medical equipment. All of it billed to Medicare, none of it ever delivered to patients. The owner, Carlos Mendez, had a simple system. He would bill Medicare for the equipment, get paid, and then store the equipment in his warehouse. If Medicare ever audited him, which they rarely did, he would point to the equipment and say, "It's ready to ship." But it never shipped. It just sat there. Mendez used the money to buy a beachfront mansion in Miami, a yacht, and a collection of exotic cars. He also owned a private jet. He was arrested trying to flee to Costa Rica. His assets have been seized. One patient, Eleanor Thompson, an 83-year-old woman from Ohio, was billed for over $40,000 in back braces and knee braces. She never received a single one. She had no idea her Medicare number had been used until a federal agent knocked on her door. She thought she was in trouble. She was crying. The agent had to explain that she was the victim, not the criminal. Another patient, Robert Morrison, a 71-year-old man from Michigan, was billed for over $60,000 in equipment. He never received anything. He had no idea. He only found out when his Medicare summary notice showed charges he didn't recognize. He reported it. His report helped trigger the investigation. Let me give you another example from this part of the scheme. In Nevada, a warehouse operated by Desert Medical Supply was found to contain over 30,000 back braces stacked to the ceiling. 3 shifts of workers were boxing and shipping, not to patients, but to a recycling center. The braces were being sent to be destroyed, but Medicare had already been billed. The owner, Robert Kleinman, had a simple system: bill Medicare, get paid, destroy the evidence. When the FBI raided the warehouse, they found shredders running. Kleinman was trying to destroy paper records. He didn't have time to destroy the braces. 3 semi-truckloads of medical equipment were seized. Kleinman was arrested at his home in Las Vegas. He had a suitcase packed. He was planning to flee to Mexico. The FBI stopped him at the airport. He's now facing up to 40 years. His wife, who helped run the business, has also been charged. She's cooperating with investigators in exchange for a reduced sentence. Kleinman, he's not cooperating. He's blaming everyone else. The most disgusting part of this scheme was the hospice fraud. The same network that ran the telemedicine fraud also operated fraudulent hospices in Michigan, Ohio, and Florida. The hospices, Great Lakes Hospice, Midwest Palliative Care, and Sunshine State Hospice, enrolled patients who were not terminally ill. Some patients were still working full-time jobs, some were running marathons, some had no medical conditions at all. But the hospices billed Medicare for daily hospice care, over $200 per patient per day for years. One patient, James Thompson, a 68-year-old man from Michigan, was enrolled in Great Lakes Hospice for 4 years. He had no terminal diagnosis. He had high blood pressure. He was still working as a truck driver. The hospice listed him as having terminal lung cancer. He had never had a chest X-ray. When investigators asked James about his hospice enrollment, he said, "I'm not dying. I feel fine. What are you talking about?" He had no idea he had been listed as terminal. None. The owner of these hospices, Patricia Gomez, used the money to buy a ranch in Texas, a collection of luxury cars, and a private jet. She also paid herself a salary of over $3 million per year. But here's the worst part. While Gomez was billing Medicare for hundreds of patients who weren't dying, real hospice patients, people with actual terminal illnesses, were being turned away. One hospice in Michigan told the DOJ that they had to put over 50 patients on a waiting list because Gomez's hospices had blocked referrals through kickback schemes. One family, the Wilsons from Ohio, told investigators that their mother, Dorothy Wilson, was diagnosed with terminal cancer and needed hospice care immediately. They called 3 hospices. All 3 were full. Dorothy spent her final weeks in pain with inadequate care. She died before a space opened up. Gomez was in the Bahamas that week. She's currently in federal custody. Her lawyer says she's cooperating. Her bank account says otherwise. And the hospice fraud wasn't limited to Michigan, Ohio, and Florida. The network also operated a hospice in Arizona called Desert Comfort Hospice. That location enrolled over 600 patients who weren't terminal. One patient, William Jenkins, a 74-year-old veteran, was listed as having terminal lung cancer. He had never smoked. He had no respiratory issues. He was still playing golf twice a week. Desert Comfort billed Medicare for him for 3 years, over $200,000. Jenkins had no idea. He only found out when a family member saw his Medicare statement. He's now suing. His lawyer says, "This is elder abuse, pure and simple." I couldn't agree more. Every one of these cases started with a whistleblower, a person who worked inside the scheme and decided they couldn't stay silent anymore. The whistleblower in this case was a nurse named Jennifer Walsh. She was hired by Great Lakes Hospice in 2022 as a patient care coordinator. Within weeks, she realized something was terribly wrong. She was assigned over 200 patients. She was told to document daily visits, even though she never visited any of them. She was given pre-filled nursing notes, all identical, and told to sign them. She was told to ignore patients who called with complaints. When she confronted her supervisor, she was told, "That's how hospice works. The patients don't know the difference. They're old. They're not going to remember if a nurse visited or not." Walsh quit the next day, and then she called the HHS Office of Inspector General. She provided copies of patient files, billing records, and emails. She identified specific patients who were not terminally ill. She provided the names of doctors who were signing fake orders. She gave the investigators everything. The investigation took 2 years, but in early 2025, the hammer finally dropped. Over 50 people were arrested: the 4 doctors, the hospice owners, the telemedicine executives, the billing specialists, the call center managers, all of them. Walsh is eligible for a whistleblower reward of up to 30% of what the government recovers. In this case, that could be up to $240 million. But Walsh told reporters that she didn't do it for the money. She did it because, in her words, "I couldn't sleep at night knowing that dying people were being neglected while the executives got rich." That's the kind of person we need more of. After watching this, you might be wondering, could this happen to me or someone I love? The answer is yes. Here's what you need to know. First, if someone calls you offering free medical tests or equipment, be suspicious. Legitimate medical providers don't cold call patients. If it sounds too good to be true, it probably is. Second, never give your Medicare number to anyone who calls you unsolicited. Hang up. Call Medicare directly at 1-800-MEDICARE. That's 1-800-633-4227. Ask them if the call was legitimate. It almost certainly wasn't. Third, check your Medicare summary notices. Medicare sends these every 3 months. Look for charges you don't recognize. If you see a test you never received, a device you never ordered, or a service you never got, report it immediately. The number to report fraud is the HHS OIG hotline, 1-800 HHS Tips. That's 1-800-447-8477. You can report anonymously, and if your report leads to a recovery, you might be eligible for a whistleblower reward, up to 30% of what the government recovers. One more thing about protecting yourself. Medicare has a new feature. You can now freeze your Medicare number just like you can freeze your credit. Call 1-800-MEDICARE and ask for a Medicare number lock. It takes 10 minutes. Once it's locked, no one can bill your number without your permission. If you're not using your Medicare benefits regularly, lock your number. It's the best protection against fraud. Do it today. $800 million. That's the size of this fraud scheme. But that number doesn't capture the human cost. Think about the 50,000 patients whose Medicare numbers were stolen. Think about the families who spent years thinking their loved ones were dying because a corrupt hospice listed them as terminal. Think about the real patients, people with actual terminal illnesses, who were turned away because the fraudsters had filled the system with fake claims. Think about Dorothy Wilson, who died in pain because no hospice had space for her. Think about the Wilsons, who watched their mother suffer because Patricia Gomez needed a bigger bonus. The DOJ is cracking down. This takedown was massive. But there are more schemes out there. There are more fraudsters stealing from taxpayers, and they're counting on you not paying attention. The whistleblower in this case, Jennifer Walsh, didn't stay quiet. She spoke up, she did the right thing, and because of her, hundreds of millions of dollars will be returned to Medicare. Hundreds of millions that can be used for real patients with real needs. That's justice. Slow, imperfect, but justice. If you see something, say something. Report fraud. Protect the system that millions of Americans rely on. The fraudsters think they won't get caught. They're wrong. The DOJ is watching, the whistleblowers are coming forward, and the hammer is about to drop. I'll see you in the next one.